Now, today is International Albinism Awareness Day, a moment to honor the challenges and also celebrate the lives of people with albinism globally. It's a day dedicated to promoting inclusion, ensuring life preservation, and dismantling long-standing myths and stigma. In Nigeria, individuals with albinism face barriers from social exclusion and bullying to serious health risks like skin cancer and visual impairments. But with greater awareness, accurate medical care, and community support, we can truly change lives.
And so to help us explore this topic, we're joined by two remarkable guests. Here in the studio is Dr. Folakemi Cole-Adeife. She's a consultant physician and also a dermatologist at Lagos State University Teaching Hospital. She joins us live here in the studio, and she will work with us, or she will walk us through the clinical and preventive side. Also joining us is Teejay Ameen. He's a broadcast journalist and a person living with albinism, and he will share with us his personal insights on daily experiences, representation, and his advocacy as well. Lady and gentlemen, welcome to the program.
Thank you.
Thank you very much. Ameen, let's start with you. First off, let's talk about the challenges for people living with albinism. I mean, here in Nigeria, we have different, kinds of stigma that people go through. I was wondering how that affected, perhaps, maybe if you could give us a life experience or the experience generally of people who live with albinism, so we get a background view or perspective of this condition.
Hi, thank you for having me. Basically, I would say that it's not far from what has been known. It's not far from the information out there. But as a person living with albinism, the lived experience for me while I was living in Nigeria was the regulars, the social made for stigma, the access, the inability to access the right medical prescriptions for my glasses, and etc. So I think that conversation has been stretched. Yes, it's very important that we talk about like everything that goes on with press, but it's not so far off. I would also say that I come from a place of privilege. I'll be very honest. One thing I always say to myself is my reality as a person living in albinism while I was in Nigeria is very different from a lot of people's lived experiences. And this is because we're all born in different environments, born into different families. So mine specifically, I would say it differs. And it wasn't a regular experience because I grew up in a family where I wasn't made to feel different. There was not at any point in my life where my parents made me feel like I was very different. I went to boarding house. I did the whole round. I did everything that a normal person in quotes would do, and not until when I go into like secondary school, university, I started realizing, but it was too late because the foundation has already been set. So what I just did was just adjust and understand that, yes, you are peculiar, you're special, and you just need to just still with this same confidence that has been brewing from when we were young. You just need to just know how to adapt into the system. So like I said, my lived experience in Nigeria is very different, very, very different. So I would not speak for a large sector of people, but I would just say mine was very different.
Okay, so noting that, how significant is such a day as this for you, a person living with albinism, anybody who's empathetic to people living with albinism, or even the authorities who should take charge in providing care and policies for people living with albinism?
So now I moved to the United Kingdom, and since I moved 2 years ago, I've advocated for this because I would say that my perception on my lived experience as a person living albinism in the United Kingdom has shown me that a lot of things were happening that were not normal. The experiences I had, the way I had to adapt, the way I had to fix myself into the system, the struggles I had as a person living albinism in Nigeria definitely differs from the experiences I'm having now. And this is for so many reasons. The theme for this year is demanding our rights, protecting our skin, and preserving our lives. And because I now understand that inclusion is not just a word that can be thrown around. Inclusion, if you're using the word inclusion, and this is a very direct message to like all the government bodies in charge. If you're using the word inclusion, you have to be inclusion proactive. Inclusion proactive is not just identifying that there are people living with this condition. It's making sure that you create a very inclusive environment for them. I live in the United Kingdom now. I've been officially certified as a visually impaired person. There are accommodations that will always be made for me in every space. We have an Equality Act in Nigeria, the same Equality Act we have all over the world. But we do not see that Equality Act being put to, we do not see people acting on it. We do not see these government bodies acting on it. So it's a different thing to say you are inclusive, and it's a different thing to say you are inclusive proactive or inclusion proactive. And that's what we want to see. We don't just want to see people celebrate these days and say, oh, yes, today is International Albinism Awareness. They want to see people say, these are the steps we've put in place. I can say that for a good part of my life, 25 years of my life, I never knew that I could get assistive devices, low vision aids to help my visual impairment. I was going to ophthalmologists for prescriptions that never existed, because they could not. It's not like they did not know that I was living with albinism, but there's no structure in place to direct me to the right places to get the help that I need. So it goes beyond just giving face caps and umbrellas.
Yeah.
And sunscreens. Sunscreens are so important, but it goes beyond that. These are real issues. The quality of my life has improved because I've gotten the much needed help. So yes, please, the government bodies, don't just say you are inclusive. Be inclusion proactive. Do the right things. Identify these conditions and make sure that you are meeting the needs. That's why this thing is so important to us.
Right. Teejay has just set us on the course for our next question. I'm coming to you here, Folakemi, in the studio. He's saying that he comes from a place of privilege, and he just reminds me of back then as a child. There was an albino friend of mine, I don't know where he is now, but his name was Sunday, and for some weird reason, Sunday refuses to leave the sun, right? So by the time we got to teenage years, it was already too late. He was playing football, he had a bad eyesight, he missed the goalpost, he had wounds and sores on his skin because he was always on the sun. He would take salt, because again, the conditions were poor. But then he had to play, and we came from a neighborhood where the children could run wild and free. And so it begs to ask a question about the key medical concerns for people with albinism, put into factor privilege and the lack thereof of the privilege, and why is it early that dermatological care is very essential at early stage?
Right, thank you. For albinism, which is a genetic condition that involves the lack or the reduction of the production of melanin. It's something that is inherited from parents, and people who are with albinism, both parents must have had the gene. And in the absence of melanin, the skin is unable to protect itself adequately against the UV rays from the sun, and so they are at increased risk of skin damage from the sun. So they can develop, accelerated photoaging, also the dreaded skin cancer.
Right.
And so people with albinism need to have some degree of, or a much higher degree of sun protection.
Right.
Otherwise, as you mentioned, like your friend, by the time they're in their teens or early 20s, you begin to see the signs of sun damage, starting with the excessive freckles, and then dry, itchy skin, and then eventually the sores, which are actually pre-skin cancers or early skin cancers. Yes. Yes, by the time they start to have those sores, that's something we call actinic keratosis, which, if not treated, can develop into skin cancer. And so we see skin cancer in people with albinism as early as the age of 20 or in their 20s and 30s, if proper care is not taken. And yes, it's difficult because people with albinism are people like everyone else. Children with albinism are children who love to play outdoors, who love to play with their friends, and so they will, like your friend, not want to listen when people say, stay indoors. But the education needs to be there from an early age so that they understand the importance of sun protection and sun safety. And so we advocate that from right from when they are born, the parents of people with albinism should be educated on how best to care for their child and how to explain to them why they need to be sun safe or sun smart, which is what we talk about. So they can live absolutely perfect, normal lives. Of course, also they have issues with the vision because the melanin affects the eyes. I mean, the lack of melanin in the eyes affects vision.
Let's
and
talk
they have
about
no
that,
vision.
doctor. Let's zero in on that, because I heard Ameen in his submission tell about the uniqueness of his condition when it comes to his vision. Yeah, he said he has just been certified with as a person, as a visually impaired person.
Yes.
How different is it from someone like me using glasses?
So people with albinism, the low vision that they experience usually is not correctable by glasses. Like you're short-sighted and get glasses or you're long-sighted. So it's a bit more complicated than that. And so people with albinism, even though, you know, they are prescribed corrective glasses, it may not make much of a difference. And so there are specialized visual aids that are made for people with the kind of visual impairment that is associated with albinism. And that's what he was talking about. Because I have met a lot of people with albinism say, oh, I've been to the ophthalmologist, I've been prescribed glasses, but it doesn't seem to
Why
make
don't we
much
seem
of a
to
difference.
have the solutions for people living with albinism that have these visual impairments here in Nigeria?
So I think it's a learning curve. It's a growing trend. So
Or
we
is
have
it capitalism?
not capitalism, probably specialization in that aspect of ophthalmology because it's quite special. So just like, you know, we may have a bit of a dearth of various specialists. So there is kind of a special kind of prescription that is required for people with albinism.
Right.
But he spoke about the fact that he was in a place, he grew up in a place of privilege, which a lot of people with albinism don't have.
Yeah.
And yes, and I get to meet a lot of people with albinism who struggle to, you know, be able to afford basic things like sunscreen or even corrective lenses and things like that. And it's a challenge. And then you also have the issue of stigma. There is still a lot of stigma in some communities in the country about albinism. And I just spoke with parents who, you know, had initially kind of been ashamed of their child because the child had albinism. Some were even in denial and said, oh, the child doesn't have albinism, decide to dye their hair. Some had people threaten them. A mother said, when she was walking with her child, someone said, "Owore," which means this is money. Some people believe people with albinism can be used for money rituals. And so these are some of the challenges that people with albinism face across Nigeria and Africa as a whole. In some African countries, they have to be hidden because they are killed for their body parts to be used. So these are things that we need to change this narrative and make people realize that people with albinism are people just like you and I.
Right.
They are not going to be useful to you for anything if you think like rituals like some people believe. And they shouldn't be discriminated against because of their skin color. All skin colors are beautiful, and we should appreciate everybody in whatever skin tone they, you know, appear or find themselves.
Just you talking about that open sore and saying that's an onset for what could be cancer.
Yeah.
I'm still very shook by it because Sunday, if you're watching me, I hope that you're good. But let me come to you, Teejay, right, and talk about the stigma and misconceptions and stereotypes that, you know, people living with albinism face. And let's just talk about that. With your advocacy, I want you to just, you know, put out the clarion call and how best as Nigeria we can destigmatize persons living with albinism.
I just want to add that, first of all, when I said I come from a place of privilege, it did not exclude me from the social stigma that comes with persons living with albinism. Right. When I said I come from a place of privilege, it wasn't about the wealth that my parents had acclaimed. I come from a place of privilege because my environment, the environment I had, not necessarily the wealth or not necessarily the care that was given to me, which of course is very important. I'm talking about the environment I had was enabling. And that's why this conversation is so important. So it's not just about my home. It's about the whole world. It's about Nigeria and Africa as a whole. That privilege should extend to everyone in the sense that everyone should see everyone as unique in their own ways, and everyone should be more accommodating. So when I said I come from a place of privilege, it wasn't in respect to how I was being cared for. It was just the environment I was born in. And yes, I also want to say that it's not as deep as we are phrasing it when it comes to like the assistive aids that persons with albinism need. It's not so special in quote. I would like to correct that because this is my lived experience. I believe that we just need to, and I'll go back to what one of you said and starts talking about capitalism. There's a lot of things that is wrong. We have these organizations, we have this government bodies set up to protect the rights. And like I mentioned, and I'll say it, I've seen videos. I'm not in Nigeria at the moment, but while I was in Nigeria, while I was doing advocacy, the reason why I wasn't associating with some bodies was because I just felt that they were not hands-on. And like I said, they were not inclusion proactive. Yes, we understand that persons with albinism need sunscreen, but I just talked about visual impairment. It's a struggle. It's a struggle as a Nigerian moving in, even in the education system. So there are a lot of loopholes there. And this is not something that it's so unreachable. It's just people doing what they need to do. So this is a clarion call to all government bodies involved. Every government body that has disability inclusive or that have set up, and these are charity organizations too, all the albinism organizations. There is more to it. That is why this thing is so important. It's demanding our rights. When you get into conversations with government parastatals, the conversation should move from face caps and umbrellas. It should move to visual assistive devices. It should move to, yes, provision of sunscreen. Yes, it should move to the World Health Organization. Just recently, there's a debate at the moment on adding sunscreen to the medical care that that persons with disabilities need in the world. That's a forward-thinking conversation. Where are we in Nigeria at that? Where are we? What are the laws that are being passed into? You don't just hand out sunscreens on International Albinism Awareness Day. What are the active things that are being done? It's just beyond a one-day celebration. This is something that should be work towards constantly. That is where we get to see. I am of the opinion that it's all in our hands. You and I. We don't have to leave it to one person. The privilege that I have as a person living albinism can be extended to everyone. We should always make sure that we create a more inclusive environment for the people around us. This goes to the education system, even in employment. That stigma that because of your visual impairment and because of how you look, you cannot do a lot of things. We should have disability confidence schemes. Employers should be disability confident. That is what we can make more people come into the system, and that is how you can actually spot actual talent. Because the odds are already against you as a person living with a disability when you have the talent. I am a broadcast journalist. I'm grateful for the platforms that gave me the platforms that I rode upon when I was in Nigeria to showcase my talent. But I'll tell you for a fact, it wasn't an easy ride. There are not many people that look like me that were in front of the camera, and that should change. So this is just a clarion call to all government bodies involved, not only just all government, this is a clarion call to all Nigerians. It is our responsibility to make the world more inclusive. It's our responsibility to make our environment more inclusive. For other people that don't exactly look like us, it is our responsibility. And that way, we're going to see a better and a more loving society. All right. Thank you.
Thank you. Folakemi, you wanted to give a bit of response.
Yes, and I would like to thank him for that very, very passionate clarion call. And there is progress. That's what I would just like to say. We have come a bit, but we need to move further. Yeah. And we have now, for instance, in Lagos State, the Lagos Office of Disability Affairs has included albinism in, people who benefit from disability assistance. And that is really helpful because it helps to get job opportunities. It helps to provide some of the things that are required, like visual aids and things. And I'm also aware now that even in exams, the WAEC and ECHO, they have separate examination sheets with larger fonts for people with albinism. Right. So that the children who have albinism, who don't see very well, can see better, and they also have extra time, a bit of extra time in the exams. So this has been as a result of some advocacy that has now birthed more inclusiveness, but we still need more. As Ameen has mentioned, we still need to ensure that people with albinism have opportunities for work, and their opportunities are considerate of the conditions. So they shouldn't be, like, for instance, walking outside under the sun. If they're in a job, they should be indoors a lot more than being outdoors. And we do need to have the health insurance scheme include skin cancer prevention and treatment as part of things that are covered under health insurance. And these are things we are pushing for. I'm very happy that the WHO is considering sunscreen as an essential medicine, because once it's on the essential medicines list, then the health insurance in various countries can include it as a drug, and it's available for people with albinism.
That's very interesting. You said I
just want to address something as well, because he was talking about my comments about capitalism. So Teejay, here's what I meant, right? And I think it's very important that I made it clear. When I said capitalism, because the field of the optometrics branch of ophthalmology, the branch of it that focuses on albinism, those who have the eye conditions, is very specialized, and you see far in between specialists. The reason why is simply because you go where the money's at, right? It's plain and simple. When you look at all of our public sector, when you look at all of the things that are popular, they're popular because that's where the money's at. And so that's what I mean by capitalism. I'm not saying it's important. It's not important. I'm not saying it's not needed. I'm saying that the reason why they're far and in between, that there are small specialists that attend to a number of persons who have these conditions, is simply because there are no numbers, there's no stats, and it costs money, and not everybody can afford it. Hence, capitalism.
Doctor, I wanted to say something. You said the Lagos State government. Now, was it the Lagos State government has made provisions for people who have...
With albinism.
With
Yes.
But what about federal government? And I'm not speaking about people living with albinism in urban areas. I'm talking about villages, because these are the people who are more prone to risk, more prone to superstition.
Absolutely.
What has been done on that,
And
in that
so
regard?
in the federal government, I can't speak for that, but I know that from Lagos and several albinism association bodies are pushing for the federal government to include, for instance, albinism in the disability list. I think it is now included. And so the Disability Act, you know, is for people with albinism can benefit from some of the things
But
there.
what policies
Implementation.
to protect people in rural areas? who
So with
albinism?
what we need is we need education. So we need a lot more of the orientation, education, promotion, so that people understand that some of these myths about albinism are wrong. That's the first step, education. And then being able to educate parents who have children with albinism on how best to care for them from an early age. So I think the government can do a lot more education. That's the first step. Public health awareness, public health education on albinism and other rare genetic conditions, because albinism is not the only genetic or skin condition we have in the country, but it's one of the most commonly seen because it's obvious. So educating people about this is number one. Number two is having health insurance for people in rural communities that can be accessible to them, because, you know, paying out of pocket for most health things is not affordable for people who are in rural areas, underserved areas, or people of low socioeconomic income classes. So we really need a lot more education. We need more robust health insurance programs that, you know, include people in rural areas.
Right.
And we're trying to push for a lot more advocacy for albinism with the government, with various states. I think Lagos is leading the charge because we're trying to do our best for people with albinism, and we're kind of pushing other states to develop such programs for people with albinism to benefit from.
When you said the skin cancer and you talked about, you know, the vision damage when you were referring to my childhood friend, I'm still very shook by it. I was this close to tears because I remember very clearly those open sores, and, you know, there was one on his forearm, there's one on his chest, and he was always running around playing football. And it's scary, right? Because I know that that neighborhood that I grew up in there, I still see children who are playing, you know, who now have freckles on their face, you know,
Absolutely.
and you can see the sun-stressed hair. But if you didn't say this, I would not know that that is, you know. So how can parents, you know, from low-income households, what are the preventive strategies that they can adopt for now, very effective ones that they can take before they can go to healthcare centers
Right.
and all of that, that is important right now? Because
Yes, so I understand, and most people don't realize that, and that's why we usually see late-stage skin cancers, because people are, oh, I had this wound, I was told it's an infection, it's not healing, it's skin cancer. You know, and by the time they come to us, there's already, maybe it's spread, and they need to have major surgery and radiotherapy, and unfortunately, we lose some people in the process. So early prevention would be children with albinism should be encouraged to wear the hats when they're outdoors. They should be encouraged not to go outdoors during the very hot hours of the day between 10 and 3. In this part of the world, you want to encourage them to say, okay, you can play football, but let's make it 5 p.m., please. Play with your friends at 5 p.m. When it's 2 p.m., 1 p.m., don't go under the sun. It's difficult, but if you keep explaining to them why it's important, eventually it will help. And then sunscreen. Sunscreen is very important. It's life-saving for people with albinism. A lot of people can't afford sunscreen, and that's why we're pushing for it to be in the essential medicines list so that health insurances can cover sunscreen, at least for people with albinism. And that would take a lot of economic burden off parents of children with albinism or people with albinism themselves. And then, yes, we do talk about the umbrellas because it's important. the visual impairment is as important, but visual impairment will not take your life. Okay, you will still survive, but skin cancer can kill.
Yeah.
And so that's why it's very important to stress particularly in this part of the world where we have high sun intensity.
Right.
People with albinism must be sun safe to avoid what can lead to skin cancer and untimely death in people with albinism. So we'll keep talking about this, we'll keep educating and encouraging people with albinism to be sun smart, to be sun safe.
Sun smart,
Yes.
sun safe. Ameen, let me come to you finally. I want to ask, after you left Nigeria and you got to the UK there, I'm sure that the kind of support that you saw from family to members of their family who are living with the condition was very different from the kind that we might expect or we see here in Africa, in Nigeria. What samples, what example, what suggestions you have for people who have members of family who are living with albinism?
All right. Based off of my experience here, first off, I would have thought, and that was the reason why, while I was in Nigeria, I was always I was looking for organizations where I could, collaborate with and, do advocacy work. And also, the sense of community is so important because you need to give everyone needs a sense of belongingness. Moving to the United Kingdom, in my research, I found out about the Royal National Institute of the Blind. They support anyone with any visual impairment with resources. We're talking about how, in WAEC now, there are larger funds and all of that. That's what the Royal National Institute of the Blind does here. And then we have the Albinism Fellowship UK and other organizations like that. But if I was going to give an advice to parents anyone that has anyone living albinism around, I think that the most important thing is to just let them know that they are special first off, which is a fact. And also, I wanted to add, when I was talking about face caps and umbrellas, I wasn't talking down on that effort, but I've just noticed that year in, year out, that is the only conversation that has been had. And that's the reason why it's also important for a person living albinism to share their lived experiences, because I know it's beyond that. Yes, I understand. Skin cancer is real. I'm wearing a long sleeve now, even here in the United Kingdom. I totally understand. The idea behind the thing for this year is just to understand that the rights that person living with albinism are supposed to have access to goes beyond that. And that is the range in the conversation that I'm particular about. There are more other things, than what is being emphasized or put forward. So my advice to anyone that has anyone around them living albinism is, like I said, it's our responsibility to create a more inclusive environment for them. Understand their needs. Ask them, how can I help you? How can I improve the quality of your life? Apart from what I know, there's something that one of the presenters said and talking about eating salt. That's a myth. And that is because, and this is something that it's not out there, and that's the reason why there's awareness. Person living albinism eats salt. Salt does not have any effect on person living albinism. I've eaten salt all my life, and it has not had any effect on me. That is what we are talking about. That is the social myth and stigma. Yeah, so I think we need to do more. Instead of just running off on myths and assumptions, let us ask more questions. Ask questions. How can I help the quality of your life? What can't you do? Not just run off with assumptions or things that people have said. And I think that way we create a more inclusive environment. And that's what changed for me here. When I go in every space I've worked in, they're asking me questions like, how can we help you? And that's the difference between being inclusive and being inclusion proactive. How can we help you? Because they don't know. So they're asking questions.
We've run out of time, but I want to say thank you very much for summarizing that inside of one question. I think that's what we all have to take away from this conversation here. And the question is, for anybody who's living with albinism, my question to them should be, how can I help you? Thank you very much for being a part of this conversation. It was very, very timely, very necessary, and you were the best person to have it with. And also to you, Dr. Cole-Adeife, thank you very much for coming in on a Sunday morning.
Thank
you go
you
to church.
for having me.
For coming in.
Don't you go to church?
No, this is our church. This is Breakfast Extra.